Hi everyone, my name is Alexa Pokrivon and I hope everyone is doing well today. I am very excited to be presenting today on sexual dysfunction and other mood disorders resulting from PCOS diagnosis amongst the female population. So I wanted to provide some introductory information on polycystic ovary syndrome, which is commonly known as PCOS. This is one of the most common endocrine disorders that affect women, especially during their childbearing years. And it is going to impact about 5 to 10% of women of reproductive age. It is a result of elevated levels of the male hormone known as androgen. So, what are the common symptoms? Many women feel that the side effects of PCOS compromise their feminine identity. So these symptoms are going to include irregular menstruation, infertility, hirsutism, as you can see in the image to the right. Other symptoms are acne, hair loss, weight gain, high insulin levels, and pelvic pain. So what is the issue at hand and that we're going to be talking about today? So while physicians recognize the physical symptoms of PCOS and work tirelessly to treat their obesity, pelvic pain, irregular menstruation, and so on, it is unfortunate that not enough attention is addressed towards the mental and sexual implications of PCOS. So our goal is to inform medical providers on the implications of PCOS on female mental and sexual health, and we hope to educate our audience so that they can better address these effects when they are treating females with PCOS. So, a little bit about sexual dysfunction. Unfortunately, a significant amount of women with PCOS, approximately 57.7%, are going to experience sexual dysfunction. So, this is typically assessed in terms of their arousal, excitement, lubrication, orgasm, pain, and satisfaction. So, there are many causes of sexual dysfunction in women with PCOS. Many women with PCOS are going to undergo changes in their physical experience. So, I had mentioned earlier that these might include obesity, hair loss, acne, and so on. And it is understandable that many females might feel emotionally affected by these changes and might struggle with feeling sexually unattractive. As a result, this really does impact their relationship with sex. Furthermore, these high levels of androgen may affect a woman's ability to be sexually satisfied. And lastly, another major cause could be infertility. So, as you can imagine, this can be a major source of stress in many women. And many couples are there going to find that the focus of sex is going to be shifted from pleasure, and now it's going to be focused on pregnancy. And that can really affect their relationship with the act. I wanted to share a little bit about mood disorders, and here we see that about 57% of women with PCOS develop a mental disorder. I listed some of them, of these mood disorders that are typically experienced by women with PCOS. But of those on this list, the most common are going to be major depressive disorder, bipolar disorder, general anxiety disorder, and low self-esteem. So, mood disorders in women with PCOS and some of their major causes. As I had mentioned earlier, many women struggle with their self esteem and their feminine identity, and as a result, this can sort of manifest into various mood disorders in women. The second issue is hormone imbalance, as it is believed that elevated androgen levels has a significant effect on the development of the brain during the prenatal period. And this can also increase one's risk for mental disorders as well. PCOS is also an inflammatory disease, so as a result, the body produces an increased level of pro-inflammatory cytokines, which can amplify mood disorders. And lastly, prolonged stress can increase the risk for mood disorders. So thank you for listening to my short presentation, and I am excited to share more information with you all very soon about PCOS, and thank you.